Hello and welcome back to the PhysioBib Podcast. This is episode 89. My name is Niels Reiter, and once again we are bringing you an episode in English. Today I'm speaking with Dr. Marcelo de França Moreira, a physiotherapist from Brazil. We met at a pain school hosted by the EFIC, the European Pain Federation, in Verona last year, where we had some inspiring conversations about the use of mindfulness-based interventions in pain physiotherapy. Marcelo since then really encouraged me to explore meditation, Tai Chi and Qigong more deeply in my clinical work, and also to start a more dedicated Qigong practice myself. I really appreciated his perspective on these topics, so we thought it would be great to share part of our exchange with you in this episode. Besides our main topic, mindfulness and mindfulness-based interventions in pain care, we also touched on what physiotherapy looks like in Brazil and how Marcelo integrates mindfulness into his daily life and clinical routine. Before we dive into the episode, I want to share a bit of PhysioBib news with you. You may have noticed that Noak hasn't been part of recent episodes and that we've had a bit of a break in recording over the past few months. That's partly because I moved to Switzerland and have been quite busy with my master's degree and my involvement in research. But another reason is that Noak is stepping back from the PhysioBib team to spend more time in working as a baker. Baking has been actually a long-time passion of his, and he's now very dedicated to focus on it more seriously. And while we won't be doing an official farewell episode, I want to take a moment here to express my thankfulness to Noak. He helped to shape this podcast and also the entire PhysioBib project from the very beginning, and I think without his critical thinking, the connection that we shared, and also his quite unique way of seeing things, this journey wouldn't have been the same. I truly hope we will get him on for some episodes in the future and maybe to collaborate on a project now and then, but for now I will continue the podcast on my own. Naturally, we as PhysioBib team, we are now figuring out how to shape the future of the podcast and the project. There are plenty of ideas floating around, but we are still finding our direction here, and we'll keep you definitely posted how things play out in the future. But for now, I hope you enjoy this episode, this time with Dr. Marcelo de França Moreira on mindfulness-based interventions in pain physiotherapy. All right, then welcome everybody to this new episode. I'm very excited for our actually second episode in English, and as you heard in the introduction today without Noak. But nonetheless, I have a guest who I'm really looking forward to. Marcelo is with us today. Hi, Marcelo.
Hello, Niels.
It's very nice seeing you after like 5 months when we have met in Italy.
Yes, exactly. We had to postpone a little bit this meeting several times, but now we are here. Make it happen.
Mm-hmm.
I'm very happy to be here.
Yes, one time postponing an episode because of Carnival in Rio de Janeiro. That was a funny thing.
Yes, exactly. It was so a mess here in Rio de Janeiro to be very difficult to record something without a very loud noise in the background.
Mm-hmm. Yeah, so do you want to, should we dive into it? Do you want to introduce yourself to our listeners? Where are you? Who are you? What are you doing?
Yep. So I'm from Brazil. My name is Marcelo de França. In the Carioca Carioca style to talk English. So I'm physiotherapist. I'm working in Rio de Janeiro. I'm quite involved in physiotherapy, work with chronic pain, and also in the research in this area. And I'm particularly interested in mindfulness-based intervention. That is one of the main topic of this conversation. So I'm really happy to be here and very happy to answer the questions and take the conversation.
Mm-hmm. Yeah, I must say you really influenced me. Like since when we did these Tai Chi exercises like 5 or 6 months ago, I really implemented that into my week. I do it a few times a week, and also in my practice more and more in the last months. Do you want to share a little bit your journey into these mindfulness-based interventions? How did you get there to do that in your physiotherapy practice?
Yeah, for sure. My interest in body practice began early in my life. When I was 15, I had my first contact with yoga. It gave me the opportunity to experience body and movement awareness, meditation, both central elements that I would discover after some years, to physiotherapy in a certain way and mindfulness intervention. So at that time of my first contact with yoga, so I was a teenager, I couldn't really afford to pay for classes, but fortunately I found a teacher who offered free weekly sessions. And I still remember how excited I felt on class days. It might sound simple now, but like the influence that you felt in our spontaneous classes during the course, it's a kind of anticipation about what it really deeply the practice resonating us. So at this time, since I was just a teenager attending regularly to the class, and my teacher invited me to join other classes for free and give me the opportunity to be a more frequent practitioner. Later on, the same teacher, seeing how committed and passionate I was, he offered me an informal teacher training. So when I was 18, I started to teach yoga myself. And I was always fascinated, not just by the philosophy, but especially by yoga's therapeutic potential. So at the same time, I was really curious about what the scientific evidence, had to say regarding this practice. And during these yoga trainings and the other masterclass related to this kind of theme, before my undergraduate school, I encountered different somatic education approaches, including Feldenkrais, Alexander techniques, Eutonia, and I was really inspired by the style of this practice. They focused in different things we were often seen in the general exercise approach, like promoting smooth fluid movement, muscle tone regulation, encouraging relaxation rather than building strength or focusing on physical conditioning. So when it was time to choose the university course, physiotherapy was clearly the right path for me because of this kind of practice. But at this time, the term mindfulness wasn't really being used yet here in Brazil. The most well-known type of meditation, for example, connected with health, was transcendental meditation approach, a different kind of approach. I only heard about mindfulness-based approach a couple of years after I graduated, but as soon as I did, I knew it was exactly what I had been looking for. So it brought together structured meditation training and brought also the scientific interest that I felt just emerging in me. So it made total sense to me. And after that, I took several trainings from institutions in Brazil, including one delivering in the University of California, held in Brazil. So since 2008, I have been integrating mindfulness in my physiotherapy work, and by one session for chronic pain and in group settings across private and public health system and research projects. So
Yeah, very
it
interesting.
is my start.
Very interesting. That's a long journey already with mindfulness techniques. I think before we dive deeper into that, I think for us as the mostly German listeners, we have a very unique chance also today to learn a little bit about physiotherapy in another system. Maybe it could be very nice if you like just briefly tell our listeners a little bit about how physiotherapy works in Brazil, what it's like, how the profession is working.
When we see about physiotherapy in other countries, I feel that physiotherapy in Brazil, comparing to this, has a tradition of being quite diverse, I think, which I believe reflect our cultural diversity as a whole. In terms of formal training, our graduated curriculum requires us to gain experience across the main fields of physiotherapy, including neurology, cardiorespiratory care, intensive care, musculoskeletal practice, and others. I personally have been working mostly in musculoskeletal physiotherapy and chronic pain. So, and it also appeared to be the main area of interest for many professionals here. So it is, in fact, it's the field I'm being involved in. So I can't really speak for all the areas of practice. I think over time we have seen clear waves of interest in various methods here in Brazil. One thing that has always been particularly strong in Brazil is the emphasis placed on manual therapy. It's widely practiced and considered fundamental. But early in my career, many physiotherapists aren't familiar with scientific literature here. This maybe lead to a strong emphasis on branded techniques, like those that had a specific name, rather than on principles behind them or the evidence available about them. For example, instead of valuing joint mobilization as a general therapeutic approach, we are seen as less qualified if we didn't train it in branded methods like Bulligan, Maitland, and global postural reeducation technique. And it was happening when there was no real evidence comparing these techniques, which, to be honest, it's still pretty much the case today. Later on, Brazil physiotherapists started more into specialized exercise approach like Pilates. Gradually, there was a shift toward evidence-based exercise interventions that gave him more visibility to methods like segmental stabilization and other approach that focus on more biomechanical precision. Nowadays, I have noticed a growing appreciation for both osteopathic approach and more hands-off strategies, as well as exercise-based intervention that are a bit more grounded in psychological principles like graded exposure, pain education stuffs. But with the boom of the social media, it's hard to keep track of the trends. People are being influenced by all sorts of content, for better and for worse. So this is the map of the physiotherapy in Brazil just last years since I was graduated.
Mhm. Yeah, that's super interesting. I think some of the German physiotherapists will recognize some very well-known problems that you also mentioned a little bit. And it was actually one of the main things I always took away from these pain schools, the two of them where I went, that the problems where we think that we have in German physiotherapy only, most of the countries in the world have, like with this implementation of scientific evidence, what you meant like branded courses that are more like centered all around a person and not around an evidence base or something like that. That's super
Yeah.
interesting to hear. Yeah. Mhm.
Mm.
Yeah, you mentioned that you're doing a lot of different things today. So you're practicing. You're also doing quite some research. I just looked up your ResearchGate account before our conversation. Do you quickly want to tell us a little bit about what are you involved in at the moment?
Yeah, I'm constantly involved in clinical practice. In my private clinic, I work on uh, 4 days in my private clinic as a physiotherapist, and 1 day at a public hospital. In addition to that, I also lead 3 online intervention group for patients from the public health system. These groups are part of the ongoing treatment for patients with pelvic pain, and also integrate into an observational study. So it is a mix of physiotherapy work and research work at the same time. So, and the last of half of my days is dedicated to research activities such as studying data analysis, scientific writing, and development of new projects. So I try to balance these 2 activities. And I would say that nowadays it is almost half to half. I dedicated half of my time with seeing patients and implementing things that I'm studying also in my research part of the day, and doing research more directly in the other half.
Mhm. So your week has like 10 days with 5 days of practice and half practice and
Yeah, it's not easy to balance, and I was talking with you about that. It is one of the reasons that I refrain a lot to include other other things, other projects, and so hard to be here doing the podcast, because I try to care myself also. So it and we require a lot of time to do all this stuff.
Mhm. Yeah, all right. I think that we have covered the things that we wanted to talk about in our introduction. Should we then dive into our topic that we set as a goal for today?
Yeah.
Yeah.
Um,
I mean, we wanted to talk about like mindfulness-based interventions in physiotherapy, which is, I think, like a specific goal that we had in mind. But for the beginning, I think it's very useful to define mindfulness a little bit more. Do you want to explain in the beginning what mindfulness means and what a mindfulness-based intervention is?
yeah, for sure. I think it is useful when we start to try to understand mindfulness. It's important to clarify that the term can refer to different things depending on the context. It might mean a trait, a stage, or a type of intervention. So it's a little bit confused for those that are heard that for the first time. So, as a trait, mindfulness refers to a personal, natural tendency to be present and aware in daily life. We can say that some people are naturally more mindful than others. As I state, mindfulness describes a kind of mental quality we experience when we intentionally bring our attention to the present moment in a particular way. So it's aligned with the widely used definition that most people heard about mindfulness, that is from John Kabat-Zinn, the pioneer to bring mindfulness into Western healthcare, who defined it as a pay attention in a particular way, on purpose, in the present moment, in a non-judgmentally way. So it is a state in this case. However, when we talk about intervention, mindfulness refers to structured programs that use formal meditation practice. So usually these programs are composed by the meditation practice, inquiry, which is the process of sharing and reflecting on what was experienced during the practice, and psychoeducational components. So these interventions are designed to help individuals to develop skills that, as a result, can improve well-being, support them in dealing with challenging experiences such as aversive emotions, pain, and stress. So when we say mindfulness-based intervention in the context of therapy, we are usually referring to this last one, or structured approach that integrate mindfulness practice into clinical treatment.
Mhm. And so, when you talk about this definition in the beginning of your personal journey, you also mentioned that you experienced or practiced a lot of different methods. So, would you say that there are like different ways to mindfulness, different methods that exist? Yeah.
I think it is also important to clarify that the mindfulness-based program aren't just about technique,
Mhm.
teaching a technique specific of meditation, particularly. It's just a structure that combines different elements. So these elements are grounded in well-defined structure that integrates contemplative practice. Most of the contemplative practice influenced by the Buddhism tradition,
Mhm.
but also with scientific knowledge that comes from psychology, medicine, and education. So if we would talk nowadays about the list of mindfulness-based intervention that exists, it would be quite an entire conversation about that because there are a lot of them. But in reality, only a few of them are supported by solid evidence. So most of the well-structured adaptation actually originate from the first structured program, the mindfulness-based stress reduction. So it's like the mother or the father of all the other interventions. So it was developed for the general population dealing with stress, pain, emotional challenge, thus all of us. From there, other programs emerged that kept the core elements of the mindfulness-based stress reduction, but were tailored to specific conditions or populations. For example, there are mindfulness-based cognitive therapy developed to prevent depression relapse, mindfulness-oriented recovery enhancement, which address things like pain and medication overuse, mindfulness, a program elaborated specifically for chronic pain, mindfulness-based pain management, and mindfulness-based relapse prevention focus on substance craving and addiction. So these programs share key components, such as using meditation as the main tool, integrating reflective inquiry and education themes, but also include unique elements that reflects the needs of the target population. Um, but I think one thing it's really important to clarify is that um, mindfulness programs are multidisciplinary in nature, so meaning they are not exclusively to psychologists, except the MBCT, mindfulness-based cognitive therapy, which require formal training in psychology. Most of the other programs accept professionals from various backgrounds to take part in the teacher training. It's not just to psychologists. But regard what is more suitable to physiotherapists, for example, it really depends on the intention. Of course, delivering a structured age-week programs is quite different from integrating mindfulness principles into regular physiotherapy sessions. If a professional is intended in offering a full program, any version that align with the clinical context can be considered. On the other hand, if the goal is to bring mindfulness into physiotherapy session more informally, MBSR or programs focused on pain management may be more suitable because it's easy to adapt to the kind of challenge the physiotherapists typically encounter in practice. So make the clinical application more easy, more feasible.
Mhm. So from your perspective, I think for many of our listeners, it might be probably that it might be probably that way that mindfulness is not a typical part of like the traditional physiotherapeutical curriculum. Maybe some more methods that are connected closer with movement or mindfulness interventions that have a movement part in them. But you would also say that, yeah, also meditation, mindfulness parts that are not like primarily focused around movement could also be a part then for physiotherapy.
Yeah, for sure. I think that traditionally the mainly in the science of physiotherapy, we bring a lot of methods that have more to be with biomechanical principles and influenced by physical conditioning. But for example, methods of somatic education, as I mentioned, that I had in touch in my early life, like Feldenkrais technique, Alexander, that put more emphasis on body awareness, regulated tones, attention to the body. They did not enter traditionally into the mainstream of the physiotherapy, and maybe it would be the most close approach of what we try to convey in the mindfulness practice. Maybe it's one of the reasons why mindfulness is still so far from the science of the physiotherapy itself.
Mm-hmm. And are there like specific protocols that are also developed for physiotherapy, or is physiotherapy still like taking parts out of other concepts or psychological theories or so, and like starting to implement that in physiotherapy? How would you see that?
Let me see. We don't have a specific protocol for physiotherapists. Maybe there are some well-known in the research arena of this practice that explore more, develop mindfulness through the movement, but it's completely outside of the mainstream of the science yet. So we don't know a lot about the particular effect of this kind of interventions, and the protocol that we have more information about are MBSR and BCT, and so directly related to the physiotherapy approach, we don't have, unfortunately, any structured protocol that is dedicated to integrate more closely with our physiotherapy approach in group setting or in one perspective, one kind of work. So the question is, unfortunately, the answer is, unfortunately, we are just trying to bring some concepts to the physiotherapy yet, but we don't have any structured protocol well studied in the field of physiotherapy.
Mhm. And when you are in your own practice, I can imagine you also talked about that in Brazil, physiotherapy is traditionally very manual therapy oriented. I can imagine that there are also a lot of patients that don't really expect a mindfulness practice or like practicing mindfulness in physiotherapy. How do you introduce that in your therapy sessions then?
Yeah, I think one of the most important moments is during the initial assessment or the early sessions. That's a great time to educate patients about how we view the therapeutic process and the reasoning behind the approach we are proposing. So this is where we can start to introduce how the way we relate to the experience can play a role in your symptoms, for example. Um, we don't necessarily have to start to using the words mindfulness or meditation. Sometimes it's more helpful to talk about how the moment-to-moment experience, whether pain, stress, or fatigue, is shaped not only by biological process, but also by the attitudes we adopt as a sensation arise. This kind of education helps create a space for mindfulness principles to naturally make sense in the context of therapy. So to be introduced for the patients. In practical terms, these principles can be introduced through familiar elements in the session, like inviting the patient to notice the sensation of the body part in contact with the ground or shift attention to the area of stretch. From there, we can support attitudes such as non-reactivity to automatic muscle response, acceptance of sensations as it is, and the ability to explore the full range of what they feeling without becoming stuck on just one part of the experience. So all of that are mindfulness elements that can be conveyed for the patients in some and included in some elements that we already use in practice, in clinical practice.
Yeah, that's super interesting. And now I think we want to dive a little bit deeper into that, how mindfulness and pain maybe interact then. In your therapy, what kind of goal do you set then for these mindfulness-based exercises? Is it pain reduction? Is it acceptance? Is it reducing of suffering? Is it improvement of quality of life? Do you make this explicit, or how are you organizing that?
Yeah, it has to be really clear that when we make pain reduction in the context of mindfulness or a reduction of any unpleasant experience, the explicit goal during, for example, a mindfulness training, we risk falling into a trap uh, because we create a mindset that can lead to striving, frustration when results don't come quickly, unhelpful self-judgment, and effort to become counterproductive or stressful. So when we target pain or unpleasant experience to be reduced during this approach, it leads it's tend to lead the patient to the opposite direction that we want. So the goal isn't to reduce pain directly. It is cultivate the skills and attitudes that the training is designed to develop, like awareness, non-reactivity, acceptance, tensional flexibility, and so on. So in the long run, our perspective should shift towards something like I practice mindfulness to care myself and to train for adversity, not to eliminate pain or eliminate the adversity. Of course, it's great when pain and discomfort go away, but no state, pleasant or unpleasant, lasts forever. So that's just part to be human. This approach is also healthier than to purely this biomedical idea of fixing pain or achieving a completely pain-free life. Uh, that's almost like experiencing we can reverse the aging process. It's a comforting idea, but it's not realistic or helpful. It's more a more balanced view is incentivized, is encouraged during the mindfulness approach, focusing on learning to live well with whatever is present instead of constantly fight to make things different. These include pain and any other discomfort.
Yeah, very nice. I think that's also exactly what I found so useful about these techniques. That I mean, I'm doing like chronic pain therapy since quite a while now, also, and with all these psychological based interventions, acceptance and commitment therapy, and so we always have this goal of like separating pain and the reaction to it a little bit, and then making this space between the two a little bit bigger, making a like creating a little bit more orientation and control in this space between the two. And I think this is what I found so useful about these mindfulness techniques to really use them for opening up this space. Would you agree with that?
Completely. It's completely different from what uh, we learn in physiotherapy and other approaches that are designed to target directly the pain relief, the discomfort, go away the discomfort, manage the discomfort. I would say that mindfulness and other approach that have the same strategy. Uh, it's not that we obviously that on long run we have a desire, have a desire to have a more comfortable life. However, the strategy to target that directly is not the better one for this kind of approach. So this is the difference. So the target is the learning some skills rather than the achieve something with this directly, you know.
Mm-hmm. Mm-hmm. Still, we are in a healthcare setting that has to be in some way like has economical interest and so. Um, so we always have this kind of idea to measure, evaluate the effectiveness, the effects of our therapy. With this complex goal of mindfulness, do you have a specific strategy that you use in your therapy to measure progress?
Yeah, from the research perspective, we often use validated self-report measures to assess change in mindfulness-related skills, pain intensity, emotional distress. Importantly, in this context, we should also track whether the change in the adoption of the mindfulness quality are directly linked to the outcomes we care about. Uh, Given the aim of mindfulness training, it is especially important to go beyond symptom reduction in the measure and include more, we say in science, humanistic assessments like resilience, vitality, well-being, and not just pain scores. In the clinical setting, it is often more subtle and experiential to capture these changes that mindfulness can produce. I usually pay attention to how patients begin to relate differently to their experience, how they talk about pain, stress, or difficulties. You can often notice change in how they respond to challenges that emerge during the physiotherapy, like a fear of movement, tolerance to effort, and so on. And over time, usually, hopefully, there is a shift in how they relate to what was previously perceived as a challenge.
Mm-hmm. Mm-hmm.
So it's a more subjective way that is captured in the way and the patient express in the facial mimic during the sessions, things like that.
But do you use some of these questionnaires in your practice, or is it more than the like?
Mm, no, just in research, but I have uh, a better sense what this questionnaire convey. So sometimes I adapt my questions, my talk with the patient, guided by some of the content of some of these questionnaires, but uh, not so structured as we do in the research scenario.
Mhm.
I try to capture it more naturally, more ecologically with the talk, with the spontaneous reaction of the patients to some provocations in the physiotherapy sessions.
Another question that came to my mind, you also mentioned that yeah, for you it's about like learning to be able to yeah convey challenges or to integrate challenges in your life. For some patients, I can imagine, especially when they have like for example, neuropathic pain or so, pains that are quite uncomfortable, that are sometimes really hard to endure. It can be quite, from my perspective, can also be quite risky to bring more awareness into the mind also. Do you think there are any side effects, precautions, contraindications? We discussed about that a little bit in Italy, but I think that should be very interesting to discuss.
Yeah, I think more than talk about the increase in discomfort, that may be something that we can anticipate to the patients, uh, uh, teaching them that attention uh, play a big role in the modulation of how we sense the things, and how we use our attention can be a powerful modulator of how we are feeling in a given moment. A part of this more simple context in terms of real side effects, while mindfulness is generally safe, some individuals may experience increased anxiety, emotional distress, dissociation, or even panic, especially when the practice involves extended silence or turning inward too quickly. For example, during a very brief 7 to 10 minutes guided mindfulness practice I was delivering at a professional congress to a group of around 13 to 14 psychologists. 3 of them reported experiencing early signs of panic. So that's really, it's really a highlight for me how important it is to guide this practice with care, even among people who are very familiar with mental health concepts. As for precaution, it's important to introduce mindfulness gradually and create a supportive space where patients feel safe. Safe to practice, but also safe to report any side effect. Being clear about what mindfulness is and what it isn't help to manage some expectations that maybe make patients endure more than they should in some practice, and step back and report and giving us the opportunity to adapt that. It's also important to monitor response and adjust the approach when needed if someone starts to feel overwhelmed. When it comes to contraindication, mindfulness are generally not recommended as a first-line approach for individuals dealing with acute psychiatric conditions, such as active psychosis or severe depression with suicidal ideation, unless the practice is especially adapted and delivered by trained clinicians like a psychiatrist or psychologist that work in this context. So while mindfulness is great, has great potential, it's not one size fits all solution, like sometimes the media suggests. And we need to stay responsive to the specific needs and vulnerabilities of each person we are working with. So, but in the pain context, just in the pain context, it's okay to anticipate it to the patients that when we bring attention to the body, it's possible that some symptoms seem increased. So it's part of the process, and try to teach them how to deal with this is part of the learning process. So explaining and educating about that is really important.
Mm-hmm. Mm-hmm. Yeah, that's a topic where Noak and I, Noak, the one with whom I do the podcast normally. When I was still living in Berlin, we once every week we went out to nature and were just sitting there for hours and meditating. And what I always felt that it had also some negative side effects on my life. It reduced some motivation sometimes. It reduced some drive for a project that maybe wasn't so close to me anymore. So um, it 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 impacted me very positively in some ways, but also in some ways maybe impacted me also in, yeah, maybe not a negative way, but it changed my perspective on life, and by that perspective on my job, for example, or so. This is also a side effect that it can have. Would you agree?
Yeah. I think it's important to. This is the moment where are important. We have a guidance
Mhm.
with people that have more experience in this process, and because it will be probably a theme of investigation during the practice, why it is happening, and as we progress, we will also gain awareness about why and how to deal and why it's happening, and you will find a way to deal with that, not necessarily stepping back to the practice, but inside the practice itself.
Mhm. Yeah, so when you're talking about experience, so it's probably also very important as a therapist that shares some of these mindfulness-based exercises, practices, to have some form of practice on your own. How does your own practice looks like in that way? How do you prepare yourself
uh,
for a proper mindfulness-based physiotherapy?
yeah. Yeah, that's days I don't have fixed time for practice. I'm a little bit more flexible than in the past. I have become a bit more flexible when I sit to meditate, but I keep it regular, very regular. I usually do between 40 minutes to 1 hour of formal practice once or twice a day, aside from the time when I'm guiding others uh, in the process. My personal practice is a mix of movement-based practice and those involving more postural stillness, like mindfulness of the breath. That is one of my favorite anchor. Um, as I mentioned earlier, this body of practice had a deep impact on my personal life over the years. So honestly, meditation and physical exercise has become two core elements for me, and I honestly believe that I would be a very different person without them. So I think it is also important as a solid practice to before try to guide others in the process. I feel that we can relate more clearly with the barrier of people face when started to maintain a practice. It shape how I talk about mindfulness with the patients. It bring more clarity, more confidence, and a grounded understand of both the benefits and the limitations of the practice to communicate to the patients. Um, so it makes the guidance more honest and human. It's completely different of the path of learning we are habituated in the physiotherapy development. It's more experiential than we are habituated, in fact.
Mhm. And do you have some recommendations for like a therapist that has no experience with mindfulness so far? What could be a good starting point?
um, I think that the best way to start is it depends on the what the physiotherapist is interested. If it is for just for personal practice, you can do for personal or not for personal or professional purpose. You will have to participate in a formal program. It usually takes 80 weeks of encounters, and after that, after have some first person experience with the practice, you maybe choose to enter in a more professional training. So there are a lot of good schools around the world teaching mindfulness in a standard way, I would say. So MBSR is the most traditional program, and it's good to start with the MBSR. As I said before, um, it's maybe easy to adapt to our um, sitting in the our context of physiotherapy after have some experience in this traditional program. So I think it's the first step is try to participate in 8-week programs, and after that reflect upon that and see if you would like to go to a more professional step after that, and start with MBSR would be a good thing.
Yeah, perfect. One thing that we haven't really touched on in this episode, you mentioned research at multiple points, but I think our goal for today was really to give some insights into how mindfulness can be. What are the important points in physiotherapy? What are the important points what are the important effects that it maybe can have on your life as a therapist? And so, but to finish up this episode a little bit from your perspective, what does the current evidence say about the role of mindfulness in pain, about the effectiveness and so?
I think like any non-pharmacological and multi-component intervention, mindfulness training can influence several domains that shape our experience of pain, particularly. Some mechanisms are more directly supported by research, while others are theoretically plausible, but it still needs further exploration in the research field. We know that pain is shaped by anything the system interprets as potential threat. So this perceived threat can arise from actual tissue damage, dysregulated sensory system, or from the way we interpret both the internal and the external events. So this interpretation often manifests as beliefs and automatic thoughts. When those thoughts become repetitive and negative, like rumination, worry, catastrophizing, or remembering traumatic experience, they contribute to both to pain and emotional suffering. So mindfulness helps refine our ability to recognize and step back from these mental events, seeing them not as facts, but as passing mental activities. That shift can reduce the impact on sensation, behavior, and the reinforcement on helpful beliefs. In the research has shown that there are some key elements of mindfulness that has a particular impact in pain. So the elements of acceptance, non-reactivity, and attentional flexibility seems to be fundamental skills to reducing pain or improving pain coping and sustaining well-being in this context. So these qualities stand in contrast to several maladaptive tendencies that are well known to amplify pain, such as avoidance, hypervigilance, and externalize a locus of control that people do not talk too much in the context of chronic pain, but it happens when people rely on the external solution and avoid looking at inner change. So mindfulness encourages the opposite. Turn it toward into the experience with awareness, curiosity, build the inner resource for self-regulation. So most what we know about how mindfulness can affect positively pain comes from this kind of set of chains. Interesting at the biological level, research also shown that mindfulness-based pain relief does not rely on endogenous opioid system. That's making a special promise in the context of chronic pain, where opioid tolerance or dependency may be an issue for a lot of patients. So it could be an alternative approach for patients that has using opioids for long term. So these are the the reason of how mindfulness can affect pain that are well known in the field.
Mhm. Yeah, perfectly. I think it's so great. I think we as like pain physiotherapists or physiotherapists, we have um, so many points where our skills that we already have connect with these ideas. And I think it could be very useful for physiotherapy to adopt these approaches more, especially in pain treatment, but also in regular physiotherapy, I feel. Um, yeah, so we prepared this podcast together a little bit with our questions and so. Do you have anything to add that we haven't touched on so far?
Oh, I think we taught in the main themes for an introduction. It's a thing that is difficult to convey in a podcast because we are not in practicing together,
Mhm.
and most of what we understand of mindfulness, a great part of that would be better um, understood if we mix a little bit of theory and practice. So for the theoretical part, I think it's a good introduction. So I'm very happy to share with you.
We can invite our listeners now to take 3 deep breaths. That would be a good start, probably.
Yes, for sure.
Marcelo, thank you so much for this episode. I was really looking forward to that because, yeah, it's a really nice connection around the world with other physiotherapists. And yeah, especially these Tai Chi techniques, I took them with me. So thank you for coming here. Thank you for introducing this topic to us. And yeah, I'm really looking forward to the resonance from the German physiotherapists. And yeah, um, thank you for coming, and thank you also for you as a listener that you stayed until the end with this episode again. I'm looking forward to hear you in the next one. And with that, we say goodbye. All right.
Yeah, goodbye. Thank you for listening.